I'm a resident of Wise, Virginia. I've lived here 20 years. I serve on the Wise Town Council. I work for Lennowisco Health District. I recently retired July 1st, 2011 as a nurse practitioner, but I'm now re-employed with them to work part-time, 3 days a week, and I do women's health nurse practitioner.
Okay, excellent. So you're a nurse?
Yes.
Okay, very good. That kind of helps me know where to,
yeah.
what kinds of things to talk with you about. So when you hear the word diabetes, what do you think?
Well, I am a diabetic, and I've been a diabetic about 10 years. And, you know, I think about my lifestyle and how I'm going to stay healthy, even though it's a hard thing to do, having diabetes at all times. But my goal is to stay healthy and try to prevent some of the complications.
And what do you, so you have diabetes, what's it like in your family? Do others have diabetes?
Well, in my family, my aunts had diabetes, and they both died young, in their 50s. They had heart attacks, and then actually my brother has been diagnosed with type 2 diabetes a few years ago. But everyone's very supportive of me having diabetes, because I guess being a nurse, I've been able to, they know the complications. And my daughter is actually a family nurse practitioner, so she helps me a lot. Even though I'm a nurse, it's still hard to deal with diabetes. You know, you'd think a health professional person would know what to do, but sometimes we don't know what to do.
Exactly.
That's,
yeah, it is amazing. You know.
Yeah.
It's one thing to learn about, and it's another thing to change your own behavior.
Right.
One of the things that I keep talking with people about is the fact that diabetes really is a family matter. It really concerns many people in our families, and then we rely on each other to support one another as well.
It's like my husband, he'll say, "You want this ice cream? You want this bowl of ice cream?" He knows I love ice cream. So I'm like, "No, you know, I can't have that." And sometimes I do have things I probably shouldn't have, but he's pretty much he's supportive of it, but he forgets that I just can't eat everything I want to eat.
And sometimes they put family members put temptation.
Like, "Here, I'll fix you some ice cream." I'm like, "No." That's it.
I love to have it.
Yeah.
So, what do you do to keep yourself healthy?
Well, number one, I take my medication as prescribed to me, and I try to exercise. I'm better at times. Like, I'm planning to start back the gym again September 1st, but during the summer, I try to walk, decrease my stress level, drink lots of water. And the weight issue is the problem, because the more weight you gain, it seems like your sugar goes up and you feel bad. And it seems like I know when I'm not feeling good or my blood sugar's high. If I've eaten too big a meal, then I know I have to watch it.
Changing the diet is a challenge. How have you dealt with that?
Well, before I was a diabetic, I really didn't eat a lot of sweets. I think my problem is bread. I like a lot of carbohydrates, and so I've really tried to cut back on my carbs and eat healthy eating. I tell everybody I've been on a diet for 42 years, and it's just, I know what to do, I know how to eat, I know portion sizes, and I try to watch that the best I can.
But it's a challenge, isn't it?
It's a big challenge.
Yeah, I see that just with I don't have diabetes myself, but I've dealt with it.
It's a challenge, and luckily I'm able to buy healthy foods where some people can't buy them, but a lot of times I get in a hurry my job or traveling and I eat fast foods. But if I can, I pack our lunch going, and then we just eat out like one meal and take water. I found that really helps us traveling. And also, if I travel, which I do travel a lot, I always make sure I have peanut butter crackers, and my friends, I'm a big Virginia Tech football fan, and we go to all the games. My friends are very supportive. There's a group of 7 or 8 of us go together, and they realize I have to eat on time, because if I don't keep a regular schedule, then I feel sick, or I get shaky, or I get grouchy. So they like, okay, it's time for her to eat. That's it.
Well, and many people don't realize what that change in blood sugar does to your mood.
Right. They just don't. But luckily, I've been with these friends about 15 years, and they all are very supportive, and they realize that I cannot eat, or I need to eat on schedule, and so we.
What does stress do to your?
I think it raises my blood sugar because I get real anxious, and I know sometimes it makes me need to eat sooner than, say, if I've had a really busy day at work, I might get shaky before it's lunchtime. So I usually have a snack with me, some protein, so that I can get through the morning. Or even the people I work with know if my blood sugar's not working, they say, here, you need something to eat. So,
right.
But, I take oral medication, so it's not like I'm on insulin, but...
With diabetes in general, a lot of people have problems with depression. Do you hear people talking about that in the community? Or?
Yes, I've had patients, especially when your health starts failing you. You can't be active, and people do get depressed because they can't do the activities that they wanted to do. And I just noticed, like last night, I was out at a restaurant, and there were so many people on canes and walkers, and it just made me think that, that could happen to me if I don't take better care of myself, that I could be the person that, has a stroke or gets where I'm not able to move. And it really hit home to me last night after I was seeing a lot of people.
Kind of seeing things with new eyes.
Yeah.
Now, in the community itself, and I haven't had a chance really to see this myself, but some people tell me that there's a larger number of children that are overweight or obese in local schools. Do you know anything about that?
I don't work with children, but I have noticed in general that a lot of children, not only in this area but across the United States, have obesity problems, and that I think the school systems here are working with the dietitians to try to improve that. But I have noticed, especially because of economical reasons, people cannot afford a lot of the healthy foods to eat, and so then they have to substitute with foods that make the children too heavy. And also in this area, a lot of people, children drink pop, and I think that contributes to the weight gain.
Do you see young children being active in the community?
I'm not around children that much, but we do have a couple parks that I know the children go to. And I guess I can say there's lots of children that do soccer and football, and the numbers have been increasing. I think I forget how many hundreds are signed up for the program, so I think that's a really good thing in the area. And I know that those numbers have increased from what the coaches come to counsel and tell us. Like I said, I don't have any children or grandchildren here, so I'm not out with the kids.
Right.
And I see our children at church, but those children are all pretty active. They're in sports or in dance or at church they're active. So
Do you think there's things in the community that put people at risk for diabetes?
Of course, the way that we were all taught to cook. You know, when you've grown up in the South, you love gravy and fried foods, and I think that puts us at risk. Probably the way we were taught.
How about one of the things I notice in the grocery stores, we have a lot of food items, and sometimes they're not so nutritional for us.
I guess that's everywhere. Everywhere you go, you know, and they put those out where you can see them and you want them. And I know a lot of people like Little Debbie cakes, and you know, we've all grown up on that. And so, you know, I think also if your weight's heavy, you have a family history or a risk factor to get diabetes, then that, you know, you develop diabetes. And I know this area is one of the highest in the nation for diabetes. So I think we just have to change our lifestyle and education.
I go to restaurants sometimes and I get served this
big portion.
Do they do that here too? Do you see that here?
Pretty much. Restaurants, I think, everywhere serve big portions. And I've talked to my husband now. I said, you know, we need to split the portions, because I think most restaurants give you big portions. And I don't know, like I said, I was just in Alabama, and I know they have a diabetic problem there too. And, you know, the portions are pretty big everywhere. Or they say supersize, you know, do you want big Coke, big fries? That's a problem.
Very often, folks tell me that once they get diagnosed with diabetes, they don't always get really good information about how to take care of themselves. What happens here in this county? Are people getting the information they need?
We have lots of information available through the training programs at the health department. And for years, we've had diabetic training, so I think it's out there, and the college does that. We do it at Mountain Empire Community College and the Mountain Empire Older Citizens and UVA Wise. So I really think there's lots of information on diabetes. For several years, you know, years ago we had the Diabetic Coalition, and we worked on that, and I really think we have lots of information that we give in training, and we have training classes.
As a nurse practitioner, when you see people, do you see folks with diabetes?
Yes, I do.
And how well would you say people are actually managing their disease?
The women I saw, I think, have done pretty well. Of course, I didn't do family. I'm women's health, and I basically did the women's health exams. But a lot of times my patients can't afford, and most of the time the women I see, they cannot afford their supplies. You know, their insulin syringes, the strips, that's a big issue. There's just not money to purchase those things. I think there's lots of information given to the patients, but when it comes right down to being able to afford your supplies, medication, there's availability to help you purchase your medicine, but the strips are the biggest issue that we have.
Do people have places that they can, women, I guess, how are they getting their activity that they need just to have an active lifestyle?
Well, there's lots of activity around. If you can afford exercise classes, say jazzercise, we have that available in town. We also have Zumba, yoga. I think we have a wide variety of exercise. But I see a lot of low-income women that cannot afford the exercise. So if they can, there's lots of walking parks around, or tracks that people can go to. If they can get there. But a lot of people live where there's not walking areas, if they live outside of town, or but hopefully they tell me they walk, and I think that's the best exercise if you can walk.
Yeah,
So.
yeah. There's so many things in communities that really can help prevent diabetes. As far as, for instance, it's one thing to have a walking trail, but then sometimes if you don't have the money for gasoline, you can't drive there, or and then there's the issue of eating out. We eat out a lot as a nation, and eat fast food rather than cooking from scratch like we used to. Do you have any ideas about ways the community can start developing new kinds of messages for people?
Well, I think it would be good if we could give them simple ways to exercise, and also simple cooking tips, things that would help. And I know Shirley Miller has the classes that help patients learn these techniques, but maybe if we could travel to different areas and do it instead of just having the people travel to us. Because like you said, a lot of people don't have gas mileage, and they have to travel pretty far to get here to Wise.
So one of the things that I'm hearing from a lot of folks is the idea that people really go to church. There's a strong church connection, and that maybe the churches might be one way to reach out and spread some health messages. Do you have any thoughts about that?
Well, I think that's a good idea. I know our church has done that in the past, and if we could reach other churches, I think almost all the churches would be willing to help. I know they've helped in other ways with helping the cancer center. So I think if we approach the churches, that they would be interested.
That's good. That's good information. Now, what's happening? I know you don't have children, but you probably hear through the grapevine anyway. What's happening with school and health-related risks that might happen to children while they're there?
Well, last year I know Shirley Miller had a program in the schools, and I heard really good remarks from all the different schools in the area about exercise and eating healthy. So I can't remember the name of that program, but I know it was really fabulous, and it seems like that was good. And now this summer, actually, several different churches in the area, they had a feeding program for children that got assistance with their lunches normally. So I did this some this summer. We packed healthy lunches and delivered it to school children. And that was really interesting and good that we made sure that the children got nutritious food to eat, and they would put a healthy snack in for breakfast and then their lunch, and they gave extra healthy snacks in there. So I thought that was a really good program. I think that started a couple of years ago, but this year more churches got involved, and I know our church got involved this year. So,
do you know how many children you serve?
I know one week we gave 750 lunches.
Wow,
that was the week of the flood. So one day we didn't actually get to give many lunches, but we gave out 750, and we couldn't go to all areas, but I think we went to about 5 different areas in Wise and Norton.
Wow, that's a lot of lunches to pack.
Yeah, it was good.
Are you familiar with? I'm trying to write it down here. Camp Bethel.
Yes.
Could you tell me a little bit about that camp?
Well, that is a church-related camp, and they have a lot of functions where they have young people come and stay for the summer, and they also have it's called a ropes course, where they teach the exercise, and they have activities. They're very well known in this area. They started, I think Mr. Henry was the father, and he was a missionary here years and years ago. I'm not sure how long, but his son runs it now, and I do know that they have camps, and I think but they probably have some funds for underprivileged children to come to. But I know that a lot of children from the area go there because they learn healthy eating. They have good lessons for them, and especially the exercise.
Is it a day camp? Or?
They have a day camp there. They also have a preschool, I think, or a daycare. They have day camps in the summer that you can send your children to, and during the school year they have not preschool, but where they keep the children, daycare. It's been a while since I've had that. But I'm not sure. I think the parents might have to pack their lunch. I'm not sure about that.
Okay.
In the past, I knew they did that.
Are there other things that that are available in the community for families to do together to get active? And
Well, WISE just opened a couple weeks ago the Big Glades Community Square, and that's a park downtown that has walking, has picnic tables. We encourage parents to bring their children out and have picnics. I was trying to think what all they do together. I know we have a lot of 5K races, and we have a bike club for people join that bike club and ride their bicycles. We do need biking trails. Of course, with that comes expense, and you know, it's hard to get grants sometimes and money.
Is there any place that you can safely ride bicycle in the community?
They ride bicycles out in the areas that don't have traffic, but we have a park out in Wise that they do the baseball, football, soccer. It's called Dotson Park, and it's out of town, which, you know, is a little ways, but it has hundreds of people come out there. And the town has a plan to put a walking trail around. But right now they're doing downtown revitalization, which a lot of people walk through town. And so,
do you know who's involved with that work? Getting the trails and
the town council.
The town council. Is there? You work for the health department,
yes,
right? So sometimes those of us who are nurses or working in health aren't the healthiest ourselves.
That's true.
So I wonder, do you have any workplace wellness plan, or is there anything that you're all doing to kind of encourage others to take care of themselves?
We do that at our work. We will have an initiative that we all get together and say we're going to eat healthy, and we bring lunches, and sometimes we share. So many people buy certain items and we eat lunch together. Most of us bring our lunch, and we've all been trying to eat healthy. The governor has encouraged us to take breaks, and on our break when we have it, to get outside and walk. Some people do that.
Do you have an elevator in the building?
We do, but we take stairs, most of us take the stairs.
So those of you that are working there are encouraged.
Right. We encourage each other to take the stairs, and we all go. A lot of us go to jazzercise together, and that is a good thing to do. And then you encourage each other through the week. You know, missed jazzercise, or I think some of the girls go to Zumba now. One of our past employees has opened a fitness center downtown, and so people are going there after work.
It seems to me that this idea of support is so important.
Oh, I think so. Like I said, I've dieted for 42 years since I had my daughters. Like, okay, I should have been a lifelong free member of Weight Watchers. But, you know, I think we all know healthy eating, and we support each other, and we know that we need to eat healthy. You know, these crash diets don't work, that you just need to exercise and eat, have a plan, and eat healthy. Make out your schedule, and we share recipes. And
as you're looking towards the future with what you know about the community, do you see any things being planned that would really be health promoting?
Well, I know that in town we are working on upgrading the sidewalks so that would make it easier for people to walk. We have looked at bike trails out at the Dotson Park. We'd like to put a bike trail connecting the college, UVA-wise, to the Dotson Park, and that way it would encourage people to walk. I know I've been really interested in doing that. There's an area down in Harrogate, Tennessee that has connecting trails from their college all over, even up into Virginia, and around their soccer field, and they have a walking trail, and then on the inside they have a bike trail. So I think would be something we would like to do. That we just haven't gotten the funds yet. That's in the future, and we're real interested in getting that finished.
Sounds like a great plan.
Yeah.
And it takes time and money, doesn't it?
And
does. People.
Yeah, it does.
Yeah.
And we're doing little bits at a time. Somebody told me today, baby steps. I was talking about the sidewalks. They said baby steps because we just did a big revitalization project downtown, and we're still completing that. So, but I think exercise, we like that. We want people to be able to just, if you can't exercise, at least get out in the fresh air and enjoy the sunshine, because that makes you feel better. If you've got an illness, and I saw a man yesterday who actually had just left rehab, and he was talking about the new area and how important it is that you can now get out and you have somewhere to go and sit and walk around and visit with people.
So many young people now are staying inside.
Playing games.
Do you have any ideas about how to get these kids outside and active?
I think it starts with the parents. I think they have to encourage the children to get outside and limit the time that they're on TV or limit their video games, cell phone. The parents have to, I think, encourage them or get outside with them, throw the ball, take them on a bike ride. Swimming. We have a great new swimming pool. Well, it's, I don't know, probably 10 years old now, but it's a really good place in the town of Wise for children to come, and that's been really good exercise for children, and it's a great family place, and I think that's been utilized a lot. It's geared towards children.
And how do we encourage families or parents to do these things?
I think it takes one telling the other one that they got out with their children and did that or activities. I know that even to join like football, it probably costs money for parents, and that's hard. I think we just have to make things available that are affordable, especially in this day and age where people just, you're watching every penny, and it's hard to get out.
And it's, I think it's a challenge too, because if you live in Big Stone Gap or you live in Norton, it's not so easy to get over here to Wise.
Well, those other places have their community centers too, and they have parks and recreation directors that have activities. I know this summer in Norton they had the ACT, which is an acting theater for children, and they encourage children and they bus them in, and that was a really good way to get the children involved.
Is that still going on?
Yes.
That
ACT. Appalachian's Children's Theater.
Yes. Yes. Someone else mentioned that to me.
Yes, and that involves lots and lots of children.
And who's the person that Melissa Wharton?
Yes, she's the owner of that.
Okay.
Yeah.
Right. Yeah, someone else was telling me about that. Sounds like a wonderful.
I think we have a lot of things in this area for children to do, and a lot of times they have indigent funds, but they bring lots of children into that program. And I'm amazed how well children do public speaking in this area. They get up, they can do things. I think the children can teach other people, teach their families. Because I work a lot in the community, and I'm always amazed at how the children do public speaking. And I think the churches work with the children a lot too. At least what I've seen in this area.
Yeah. Well, I think I've covered everything that I need to, Era. Is there anything else that you'd like to add?
No, I just appreciate you doing this, and you know, we all have to work together, and I know diabetes is a big challenge. I deal with it myself, and just know how, say, your hemoglobin A1C, mine was normal for so many years, and then all of a sudden it jumped up, and so then that gets really scary. And I think too, when you first get diabetes, I know most of us get it, we're really scared. I lost a lot of weight, and I exercised, and then I just got sort of complacent about it and just didn't, I'm all right. But you're really not all right. So I think, you know, we know it's a lifelong process, and we just have to keep that in our minds and thinking about it.
Well, and you know, the wonderful thing is that if you prevent the complications, if you prevent the disease, then you prevent many other things that could go wrong.
And it's so important to have a healthcare provider that does the standards of care, what that they want you to do. And I think that's something that anyone with diabetes needs to know, those standards of care. Your eye exam, your foot exam, you know, your hemoglobin A1C, because if your doctor or a healthcare provider is not doing that, then you need to talk to them about it. And there are places that you can get your eye exams, you know, that's available. And like the Lions Club, they help you, and you know, there's resources out there. And if you don't know them, you need to contact either your local health provider, or especially the health departments in your area. I don't care where you live, because they know who the providers are and where to get you some help.
That's a great tip.
Yeah.
Really a great tip.